Okay. Next question about the cardiology. A 62-year-old man has a routine ECG preoperatively for an elective osteoarthritic knee replacement. He is in sinus rhythm and the QRS complex is not prolonged. There is a gradual prolongation of the pure interval, followed by a dropped beat every 3 or 4 QRS complexes. The ECG machine is unable to calculate the pure interval. The patient does not complain of any palpitations. What is the single most likely diagnosis? A. Sinus bradycardia. B. First degree heart block. C. Mobitz type 1 block. D. Mobitz type 2 block. And E. Complete heart block. And the answer according to the explanation will be Mobitz type 1 block, as the patient had gradual prolongation of pure interval followed by a dropped beats. And here we are going to explain different types of heart block. First degree heart block is a prolongation of the pure interval beyond 0.2 seconds, and it is a benign condition that does not require additional follow-up or management. It's not usually associated with symptoms and does not progress to other forms of heart block and is a benign condition, as we said. And here is the ECG for first degree heart block. As we see here, we have only the prolongation of pure interval, and the rest of the ECG is normal, and we cannot see any abnormality in this ECG, only the prolongation of pure intervals. And second degree AV block. There are two main types of second degree AV block: Mobitz type 1 or Wenckebach and Mobitz type 2. Mobitz type 1 or Wenckebach. The pure interval gradually lengthens with each heartbeat until a beat is completely dropped. This is often associated with a progressive prolongation of pure interval. As we can see in this ECG, we have progressive prolongation of pure interval until a beat is dropped. We have progressive prolongation of pure interval until a beat here is dropped. Here's pure interval is normal. Here we have a little prolongation, and here the prolongation is increased, and here we have a beat which is dropped. And Mobitz type 2, the pure interval remains constant before a beat is dropped. The block beat occurs without any prior prolongation of the pure interval. And here we can see, here we have P wave, but here we don't have any QRS complex. Okay, here we have P wave, pure interval, P wave, pure interval, and it's constant. There is no any prolongation of pure interval. But we have P wave, and here we have a drop of QRS complex. As we said, in Mobitz type 2, the pure interval remains constant, and there is no any prolongation of pure interval. But we have a drop beats between 3 to 4 beats. And third degree or complete heart block is a very serious condition where the electrical signal between the atria and the ventricles is completely blocked, leading to a slower and potentially irregular heartbeat. Okay, the electrical signal is completely blocked, preventing communication between the atria and the ventricles. As we can see QRS complex, and here we can see P wave, here we can see P wave, here we can see QRS complex, here we can see P wave, and there is no any relation between the atria and their ventricles. The atria are working different and the ventricles are working different. There is no any relation between them. And very important note, Mobitz type 2 and complete heart block or third degree heart block requires permanent pacemakers because they are very threatening, life-threatening conditions.